Welcome everyone to the Working Options Masterclass with the NHS. While we're all here now, if I can just ask everyone who's joined us if they could please put themselves on mute until you're ready to talk, that would be really great. So thank you very much. So very well welcome. I am Claire Mcmaster. I'm Head of Programme for Working Options in Education. Working Options is a charity that helps young people fulfil their potential by developing employability skills and life skills and providing valuable interaction with employers. And that's what we're here for today. Part of our Masterclass series is part of our Career Pathways programme. And this Masterclass is where we will hopefully share with you key insights into how a sector operates, raise awareness of the different career opportunities and pathways that are available, and discuss the key skills and qualities that the NHS here today are looking for as an insight into their recruitment process. So it's a great opportunity for you to hear how to take your next steps for the world of education into the world of work. So please take the opportunity to ask questions. The session, as we know, is being recorded, and you will be able to access the recording again after the session itself via our website, and you'll get the link directly emailed to you. So today we are delighted to be joined with colleagues from the NHS team, and I am going to hand over now straight away to Nicole and then Rob to set the scene and for you then to share their experiences. And please make sure if you have questions, pop them in the chat and we'll be able to ask them along the way so you get the best out of the session. So very warm welcome, and over to you, Nicole.
Hi, thanks Claire. Hi everybody, thanks for joining us today. It's really nice to meet people who are hoping to hear lots about jobs in the NHS and different career routes.
Can we hear that?
Yeah. Can I just ask everyone again, just pop yourselves on mute, just as a little bit of echo. My name's Nicole Baker and I work for Health Education England. I'm a project officer and I work on something called Talent for Care, which is basically helping people look at and learn about different routes into the NHS, so things like careers and work experience and apprenticeships. Prior to this, I worked as a children's speech and language therapist for about 10 years, which was supporting children aged from birth up to 16 with complex communication difficulties, cleft palate and learning difficulties. I'm just going to hand over to my colleague Rob, who will introduce himself before doing a presentation for you. And then after that, we're going to introduce our colleagues and take some questions from everybody. So over to you, Rob.
Brilliant. Thanks, Nicole. Yes. Hi, everyone. So I'm Rob Brooks. I also work for Health Education England alongside Nicole. And my role is that I work across the East of England region to support all of our employers with engaging with their apprenticeship programs and with what we call talent for care programs. So that is effectively the programs that are used to try to encourage and support people to access employment in the NHS and to grow as employees within. So I'm going to give you a bit of a whistle-stop tour of careers and apprenticeships in the NHS. So hopefully this is going to work and you'll be able to see my screen. Can everyone see that?
Yep.
Yep.
Excellent. Okay, so I guess that what I'd like to start with, often people think of the NHS, and if you haven't worked in the NHS before, it's quite easy to think of the NHS and maybe think of a nurse or a doctor, but actually there are over 350 careers in the NHS, ranging from clinical roles to non-clinical roles. And we've got a range of people in different clinical roles here today who will be able to talk a little bit about what they do and answer some of your questions. So it's really key to realise that there are lots of opportunities in the NHS, regardless of what you want to do for your career, whether you want to go and be a physiotherapist or a dietitian, or maybe you want to be a healthcare scientist, or, you know, perhaps you want to be an accountant or a project manager or work in, you know, HR. There's lots and lots of different opportunities within the NHS. It's the biggest employer in Europe. So not only are there lots of different types of careers, but actually the volume of opportunities are quite large. So, you know, I would say this because I work for the NHS, but it's a great place to work with lots of opportunities. So a lot of people think of the NHS as one massive organisation. Actually, NHS healthcare is delivered by over 1,000 organisations in England alone. So it's almost better to think of it, it's a really bad analogy, but it's almost better to think of it as a sort of a franchise system. So everyone delivering care,
join as well. Go in your phone login.
Everyone delivering healthcare in England would do so under the NHS banner. But what you will find is there will be individual employers in their own rights. They'll have their own opportunities, their own development pathways, their own working cultures. And I guess for those of you on the call who are thinking about trying to access careers in the NHS, you'll also find that each employer is responsible for their own work experience programs or sort of school and college activity. So that's really
send it to me quickly.
Someone's can you guys put yourselves on mute, please? Sorry.
It's just,
I'll carry on. So hopefully you can hear
you
me
have to do the entire application. Did we send it? Yes, last night. This was a while ago.
Just a little bit of a sort of terminology check. What do I mean by non-clinical and clinical? So non-clinical staff tend to be people within the NHS or care that are doing roles that aren't directly delivering care to patients or service users. So that would be things like clerical roles, management, sort of estates, housekeeping, those types of roles. And then on the other side, you have clinical roles where individuals are more directly involved in delivering care. So that would include like healthcare support workers, nurses, or some of the other clinical roles that I mentioned earlier. What sort of roles are there? So there's a range of roles.
Yeah, it's just some
information
about careers in the NHS.
Can everyone hear me? Okay?
But I'm happy for you to come to the office, but things have any laptops.
Hi Rob, sorry. There's a lot of people that aren't on the presentation.
But also, she's in meetings after meeting, but you can come to my office if you want.
Thank you, Miss Rita.
Yeah.
We're not going to be there because of this. No.
I'll try and keep plowing through, but there's someone with quite a sensitive microphone, I think. So if people can just try and put themselves on mute again, is that okay? I'll crack on. So as I said, there's a wide range of roles in the NHS, and we'll be hearing from a range of people later, and we'll share these slides so you can have a look in a bit more detail at some of these roles and perhaps look into detail on the NHS Careers website. So I thought it'd be useful. A lot of our roles in the NHS, there have entry points through an apprenticeship. So I'll do a bit of a whistle-stop tour of apprenticeships because I appreciate some of you would have heard of them before. They are effectively a mixture of hands-on experience and learning. So it's a mixture of on-the-job and off-the-job training where you'll learn a bit of theory and then you apply it within your role and develop your skills. You'll be paid at least national minimum wage for apprenticeships, and generally speaking, an apprenticeship can last anywhere between 1 and 6 years depending on the level, and a lot of them either include qualifications within them, or they are a qualification in their own right. So it's an opportunity to gain an accredited qualification while learning on the job. So I like to do a little bit of myth busting with apprenticeships because lots of people have heard about apprenticeships, but not always necessarily the right information, or some of it's out of date. So myth number 1, apprenticeships are for plumbers or hairdressers. So a lot of people think of the word an apprentice as being, someone stood in blue overalls or sweeping up hair on hairdresser floor. Now, while apprenticeships are for those careers, actually 75% of apprentices last year worked in roles that were in health and social care or business administration. So the vast majority of apprenticeships are actually in roles that are commonly found across the NHS. So again, while it's an opportunity for people to go and do something that might be considered a traditional trade, actually vast majority of apprentices are not working in those areas. Myth number 2, apprenticeships are for people who aren't academic. So there is a bit of a myth that people who are, you know, potentially academically sort of comfortable, they like doing sort of traditional academic subjects like GCSE and A levels, they go on straight to university and follow an academic pathway, and apprenticeships are for people who are maybe more vocationally minded and maybe, you know, not as comfortable with that traditional route. There are actually over 90 apprenticeships in the UK that contain an academic degree now. So to say that apprenticeships aren't academic is not true anymore. And even those apprenticeships that are perhaps traditionally seen as being more vocational, they often need an academic foundation as well. So for example, if you wanted to do an electrical apprenticeship to become an electrician, most colleges won't accept you on that program unless you've got a GCSE 4 to 9 in English, maths, and at least one science. So even those subjects that perhaps traditionally might have been seen as more vocational still require an element of academic learning. The only real difference here is that apprenticeships are taught a little bit differently, give people an opportunity to practice the skills that they are learning and apply that learning. So myth number 3, apprentices get paid peanuts. You might have heard of sort of old-fashioned apprenticeship schemes where apprentices got paid £10 a week. It's just not true anymore. As I mentioned, the apprenticeship minimum wage exists nationally. That has just moved up to the same amount as normal minimum wage for 16, 17-year-olds at just over £4.70 an hour. And actually, a lot of NHS employers offer a competitive entry-level salary based around our existing pay bands through our trainee pay scale. So quite often you'll be able to access a really competitive salary while also getting your qualifications paid for. Myth number 4, graduates earn more than apprentices. So often people think that you have to go and do a degree to earn more money in your career. Statistically speaking, apprentices earn over £100,000 more in their career than a graduate does. So actually, although being a graduate in certain situations is a necessity, and in other situations obviously helps you with your career, doing an apprenticeship is just as helpful, if not more so, in a lot of our industries. Myth number 5, apprenticeships don't lead to jobs. So historically, you would find apprentices would do their program and then perhaps leave their employer at the end of their apprenticeship. You don't really find that as much now, although it's still often a competitive process at the end of your apprenticeship. It's absolutely pointless us training people up for anywhere between a year and 6 years if we're not aiming to keep you within our organisations to make use of those skills that you've developed. It just doesn't make sense. So there are often, if not always, opportunities at the end of your apprenticeship to go straight into a job with the employer that you did your apprenticeship with. And in fact, some employers actually offer you a permanent contract automatically at the end of your apprenticeship anyway. So definitely not a sort of a transitory thing that you will just lead at the end of your apprenticeship. And last but not least, apprentices just make the tea. So again, another common sort of image of an apprentice is, you know, someone just doing the photocopying and the filing and sweeping up and making a tea. While that might be a part of an apprentice's job, it shouldn't be any more so than anyone else's, because actually the apprenticeship is about developing you to be able to do the job at the end. If you're doing a healthcare support worker apprenticeship and all you're doing is making the tea, when you finish your apprenticeship, you won't have the experience and the skills to be able to do the job. So it's counterproductive for an employer to just make you do the jobs that no one else wants to do. So realistically, the only place an apprentice should be making the tea regularly is if they're working for Costa Coffee or Starbucks. So a little bit more about pay, because obviously people go to work, they want to be paid. So the way that Nhs Pay works is that the pay bands start at just over £18,000 per annum. And as I mentioned, a lot of NHS employers pay their apprentices on our trainee scale, which is often 70% of the pay scale. So you're talking about quite a competitive entry-level salary. And actually, in a lot of cases, some of those apprenticeship roles are at higher bands. So you can access apprenticeship salaries at even higher rates than that. So it's a really good opportunity to earn a competitive wage while you're working. And that link there will give you an idea of the pay scales in terms of long-term career aspirations and what you might get paid at different bands. So just a bit of an overview of some of the vacancies you could have applied for recently. We've had registered nurse degree apprenticeship opportunities in Warwickshire, dental nurse apprenticeships, radiography apprenticeships. So a vast range of clinical roles, as well as things like electrician apprenticeships, sort of administrative apprenticeships in our outpatient centres. So there's a wide range of apprenticeships on offer, and generally speaking, you'll be able to see those advertised on our NHS jobs website, which I'll discuss a little bit more later, or on the Find an Apprenticeship Service .gov.uk website. So I know a lot of people think of apprenticeships and are really keen on looking at degree level apprenticeships. So I thought it'd be helpful to sort of give you a bit of a view of what degree level apprenticeships might be available. What I would say is don't get too set on the idea of going straight into an organisation as a degree level apprentice. The opportunities at that level tend to be smaller than other levels. So while there are opportunities to go in as a degree level apprentice, actually you'll find that a lot of organisations like to bring people in to sort of level 2 or level 3 apprenticeships, where they can give you a real overview of the types of careers in the NHS and get you really familiar with working in the NHS environment, and then they'll look to grow you from there. So I guess whilst there are opportunities at a degree level, don't view those as being the only option to go in. It's helpful to have an open mind and look at some of the other apprenticeships that are available. And I won't go through this list, but this here gives you an overview of some of the degree level clinical apprenticeships that you can access to go into registered clinician posts. So as I've already said, a lot of organisations tend to like to grow their own. So once you get into the workforce, your opportunities may be larger in terms of accessing different types of apprenticeships. And what I would really suggest is have a look at any opportunities you can to do to get in and get some work experience, or to do some part-time work, perhaps as you get to that age. Have a look at what is available. It sets you in a really good stead when it comes to applying for those apprenticeship roles later on. And through the NHS jobs website, you can sign up for alerts from local employers. And that will allow you to get email notifications when certain roles become available. So I've talked a lot about pathways. This is just an example of some of the pathways you might access. If you want to go into sort of paramedicine, there's an opportunity to go through a pathway to become a paramedic. I've already mentioned the idea of being a registered nurse degree apprentice. This potentially illustrates the pathway you might take. You might go in as a healthcare support worker and go through all of those apprenticeships. And again, there are non-clinical opportunities in areas such as finance and IT. And we've got a whole range of those pathways that you can view on our website, which is there at the bottom. So by all means, have a look at that. It gives you an idea of what your long-term career development opportunities might be. So how do you apply? I mentioned NHS Jobs. This is the main platform that NHS trusts, so that would be hospital trusts, community trusts and mental health trusts, use across the country to advertise their opportunities. You can search by keyword. So if you are looking for an apprenticeship, you can just type in apprentice and search. You can filter by location, by salary, by sort of type of role in terms of clinical versus non-clinical role. So it's a really sophisticated way of doing some job search. And as I've already said, you can then save that as an alert, and they will send you notifications when new roles appear that sort of meet your search criteria. And you can also find apprenticeships on the gov.uk website. It's also worth considering if you are interested in working perhaps in our primary care employers, so that would be sort of GP practices or in social care. It's also worth looking at local job boards to where you live, or perhaps speaking to employers directly. You tend to find that those organisations don't often advertise on NHS jobs. So sometimes it's worth just, sending an email or giving them a call to see what they might have available. And then the other tip I would give you is it's worth also reaching out to your local apprenticeship training providers, because they may well be advertising on behalf of other employers. So it's always worth sort of reaching out in sort of a variety of ways to give yourself the best chance. The other interesting thing on NHS jobs is it gives you some really good information relating to your applications and interviews. So if you haven't done an application before, or you're finding that you are doing applications but perhaps are struggling to get an interview, there are some really, really good hints and tips at the bottom of the homepage of the NHS Jobs website, which just gives you an idea of the sort of best way of getting an interview. And some useful things to know: don't just apply for one apprenticeship and leave it at that. Apply for as many as you are interested in, even if it's with the same employer within the NHS. You will find that different managers are reviewing those applications at different times, and you might find that, depending on the apprenticeship role and the team that you might be joining, you might have relevant knowledge, skills and values that fit one team but perhaps not the other. So don't just stick to one at a time. Apply for as many as interest you. You can only do an apprenticeship where you are going to be gaining significant new learning. So what that means, if you go off to college and do a health and social care diploma, you might find that you then can't do health and social care apprenticeship at the same level. So you have to be looking at more at higher level apprenticeships. But if you have a degree in biology, you could potentially do a degree apprenticeship in dietetics or something. So it's not necessarily the level that prohibits you from doing an apprenticeship, it just has to be new learning. Also, if you find that your maths and English grades at GCSE aren't quite what you would like, there is an opportunity to gain maths and English qualifications alongside your apprenticeship to get them equivalent to a GCSE 4 to 9. And I'd highly recommend, if you are interested in particular programs, get in touch with the line manager and the training provider to get a bit of an idea of what specifics they're looking for. When you look on NHS jobs, you will also often have a contact that you can get in touch with for the job role. You can just ask them questions that might help you when you're writing your application. So that's a good tip. I'm coming towards the end, I'm sure you'll be glad to hear. Just a little bit on values-based recruitment that I thought would be useful to share. So a lot of recruitment of apprentices within NHS is based on the values you have and the motivation that you've got and the attitude, as opposed to necessarily focusing on your experience. That's because through an apprenticeship program, we can train you to give you the skills and the knowledge you need to do the job. But actually, developing values is something that is far more difficult. So what the NHS are looking for is often individuals that share the values that the NHS is built upon. For example, the NHS Constitution is something that is the principle of most NHS organisations' values. So it's really useful when you're going into an application process or an interview process to think about, how your values relate to the values of the employing organisation. So it's worth having a look at the specific values that organisation publish, but also really consider some of these values here while you're doing that application. So I guess a lot of you possibly have tried to get work experience in the last couple of years and found it quite difficult. We are starting to see more face-to-face work experience come back post-COVID, but obviously that very much depends on the environment in the local area around sort of COVID around students that are already in place. It's worth, before you start thinking about applying for programs, think about what sort of work experience requirements they might have. Think outside the box. It doesn't have to be a hospital. It could be a care home. It could be a hospice. It could be a GP practice. It could be the voluntary sector. So there's lots of opportunities to get experience that might be relevant. Consider online opportunities to do work experience. We have, in my region in the east of England, we have our health and care academies, which do a lot of work experience activity online. And if you can't get work experience, consider volunteering. There are some age limits for some organisations around volunteering, but we do have things like the NHS Cadet Scheme. We have sort of charities that work within most of our acute hospitals. So your local general hospital will often have a charity. So think about those sort of opportunities and where you might be able to take advantage of those to develop some skills. And when you're applying for roles, don't necessarily focus just on formal work experience. Think about where you might have done things within your, personal life. Have you cared for a grandparent or a relative or a neighbor? Have you organized a prom in school? These are all things that give you a real rich vein of skills and experience that you can bring to your application and interview process. And I'm nearly there. This website is a really good website. If you're thinking of coming into the NHS, but you're not really sure what you might want to do, the NHS careers website has an overview of all of the careers in the NHS. You can do searches. There's a video which gives you an idea of how one individual might be exposed to all of the careers in the NHS during their lifetime. And there's a really nice career planning tool that you can use, and effectively it's a questionnaire that asks a bit about you, and it works out what the most appropriate career might be based on the answers you give. So if you're really unsure what you want to do, this is a really good exercise to give you a bit of inspiration. And then last but not least, we also have the Step Into the NHS website, which has similar resources to the NHS Careers website, and it's really worth having a look at that as well. This is particularly good for teachers out there who are listening in as well. There's some really good school resources on here that you can use when you're leading career sessions sort of through your PHSE curriculum. Again, all the links will be shared, as well as sort of contact details for some of our speakers today. And yeah, that's it. So thank you for listening. Hopefully you're all still awake, and I'm going to stop sharing.
Thanks very much, Rob. We have had a question in the chat about whether we're just talking about apprenticeships today. The answer is no. On our panel, we've got people from a variety of different backgrounds, a couple of live apprentices on the panel, and various other people who've pursued very different routes. So what I'm going to do now is just hand over to the panel to ask for introductions of who you are and what your job is and how you've wound up doing that job before we move on to some questions. So I'll just call out the names according to my list here. So Andy, are you happy to just introduce yourself?
Yes, thank you very much. Hi, my name's Andy Pickles. I'm a registered adult nurse. That means I work with adults from sort of 18 years old. I say sort of from because there's a slight grey area within the NHS. 16 to 18, depending on the person, is classed as an adult or paediatric up until the end of life. But that doesn't mean that I wouldn't have anything to do with children, but that's not my speciality. So I came to nursing quite later in life after having a couple of previous careers, and I hadn't realised when I came to nursing actually how many roles there was within the NHS, and it's absolutely astounding that you can come to one organisation and pick essentially one of over 350 career pathways. It's just fantastic. So I think my very first piece of advice would be to anybody who's interested in listening today would be that no matter what you think you might like to do, if you think, oh, I'd like to do something with IT, or I might want to work fixing things, I don't know, then have a look on the NHS websites and see what's available, because there's a whole raft of things. But anyway, that aside, so like I said, I came to nursing later in life, and I didn't really know what it was that I actually wanted to do, other than I wanted to be a nurse. So I took a job as a healthcare support worker. You may hear the term HCA, healthcare assistant, or healthcare support worker. The two are sort of intertwined, if you like. And I worked my way around our local hospital over here in Kings Lynn to find out what it was, or where it was that I might like to work, and be what type of career path I would take. I first started off in day surgery, and I thought, oh, that might be something quite nice, you know, or I go and see operations, I might help people through that process. And I quite quickly found that that wasn't for me. Patients were asleep. I found that I preferred patients that are awake, and I could have a personal interaction with them, because as you can probably tell, I quite like to talk. So I moved away from day surgery, and then went around all of the medical and surgical wards, and found that I quite liked orthopedic and trauma. So that's fractures, breaks of big bones, people that have had serious accidents, etc., etc. And I thought, oh, I might like to try the emergency department. So I moved on into the emergency department. I was a little bit apprehensive to start with. I was a little bit unsure about what it was that I was going to be witness to or involved with, but the support mechanisms are in place to help you deal with that, and it's absolutely amazing. I then went off and did my nurse training at one of the universities, and then I worked in the community for some time as a community nurse. So that's looking after patients within their own homes, which is an absolute privilege, because you get to see their whole life, and you can nurse somebody on a holistic level. So you get so holistic is about everything to do with a patient. I moved away from there, and then spent some time in a local GP surgery, lots of immunizations of babies. Yes, as I said, I'm an adult nurse, but that doesn't preclude me from working with infants, pediatrics, and younger members of our generation. So I did that for some time, then came back to the hospital as a registered nurse working in the emergency department. Obviously, I'd already had a little bit of a feel for that, and then I stepped up to that role, coming back into the emergency department. I spent a little bit of time around the trust doing that type of work, so the emergency acute floor, and then I moved into something called patient experience, and the clues in the title really. So patient experience is what that patient experiences when they come to our trust. And we dealt with in our department feedback. You may know that as complaints, but all feedback is and can be and should be used as a positive. It all aids to our learning and how we can improve our services for our patients, and indeed increase their patient experience. I then moved on from there into recruitment and retention, and that's where I am currently. So you've probably got a little bit of a snapshot of me there. I've moved around and done all sorts of things, but every one of those things that I've done has added to what I can give back to our patients, our colleagues, and indeed our patients' loved ones and relatives. Will I stay in this role? No, probably not. I'll probably move on to something else at some point. It's within the NHS. It's pretty much sort of what takes your fancy, really, and I would say there's probably only a few things that you need: determination, imagination, and some form of qualifications. But to go right back to the start, when you first come to interact with the NHS, and then Rob was talking about the application process, it can appear quite daunting. And Rob did mention that there will always be a department manager's name on that application process. My advice to all of you would be, make contact with that person. See if you can have a face-to-face meeting. See if you can have a meeting across teams, and ask those questions that are pertinent to you, because the role has to be right for you as well as it has to be right for us. And if we can both get it right for each other, we'll both have a flourishing career together, and your journey within the NHS will be that much smoother. So we are fully supportive within the NHS. So anything that you need, you really just need to ask. You know, anything that you're struggling with, you just need to ask. And sometimes we don't always recognise that we do need that support. And we have people in place around us that can recognise that in people and would say, oh, Andy, do you think you might need a little bit of help with something? Is everything okay? So, oh, well, actually, thinking about it, no, maybe it's not. Thanks ever so much for asking. What can we do? So that network and support mechanism is in place for absolutely everybody, no matter where you're at on your journey within your NHS career. So I did say I could talk quite a lot, so I'm going to pull out now, but if anybody's got any questions for me, that's absolutely fine. Please do fire them at me and I'll be more than happy to answer.
Thanks, Andy. That's great. Right, I'm just going to ask next. We've got Sonali. Could you just let us know who you are and what you do, please?
Sure. Hi, everyone. So I'm Sonali. I'm a trainee counselling psychologist at the moment. So I'm still training. So just a very brief overview of how I got here. So I did an undergraduate degree in psychology and sociology. And then I got various experience, voluntary and paid, outside the NHS. And then I went on to do a postgraduate certificate as a psychological wellbeing practitioner, which allowed me to work alongside my course in an IAP service, which is a primary care setting in the NHS. And then I went on to start my doctoral training. So I was working in IAP, and then I was working in a secondary care psychotherapy service. Both of those were with adults. And I'm now currently in a child and adolescent mental health service with Brendy. And I'm hoping to stay on here after I finish my degree. So there are opportunities for kind of continuing that on if you do well in your placements as well. So
great. Yeah. Thanks, Sonali. I'm just mindful that we want to make sure we've got plenty of time for questions. So if we can pare it down even just to names and jobs, that would be brilliant. So I'm going to move next to Roger.
Hi, everybody. My name is Roger Blake. I'm a learning disability and autism specialist nurse. I currently work in Ipswich. I've worked within learning disabilities in quite a few different fields. I've been working in some form with learning disabilities for about the last 25 years. I can't believe I'm saying that. Yes, if you have any questions, that'd be great.
Thank you, Roger. And next I've got Connor.
Hello, my name is Connor. Currently a therapy assistant, but studying an occupational therapy degree apprenticeship. So I started in the role. I've already been to uni and done a previous degree. And when I started, I said that I wanted to be an apprentice, particularly a degree apprentice, as soon as possible. And work supported me in doing that. And they're very flexible, and it's a fantastic way of achieving what you want to achieve whilst working at the same time and gaining experience. So yeah, that's me.
That's great. Thank you very much. Brendy.
Hi, I'm a clinical psychologist working at CAMS, which is Child and Adolescent Mental Health. And I've been here for about 4 years. And I can answer some of the questions in relation to what work experience you can get. But unfortunately, a lot of it is not in the NHS or face-to-face, as you would expect it to be. So I'll speak to that later.
That's lovely. Thank you very much. And Emma?
Hello, everybody. I'm currently working 3 different jobs, but started in the NHS 14 years ago as a clinical support worker, specifically in radiology, and that's where I've been. That is my home. I've done various roles. I've come from clinical support worker to assistant practitioner, and then from assistant practitioner to diagnostic radiographer, then to senior radiographer, then to a job as lead AHP clinical educator. And now I'm actually doing some HEE strategy work for the AHPs in our trust at the Queen Elizabeth Hospital in King's Lynn. So I've gone from one extreme to the other over a period of years, but got lots of experience certainly in radiology and across working with all the allied health professions.
Thanks, Emma. That's lovely. Donald, next.
Hello, I'm Donald. I'm the pharmacist at Luton and Dunsborough Hospital. So I just recently qualified as a pharmacist, so I've just been working as a pharmacist for less than a year. So how did I get into pharmacist? I was a pharmacy dispenser back in late A-level in a community pharmacy in Boots. So like this is a field I quite like working here, and so I did a degree in pharmacy and did one placement of pre-registration pharmacist here, and that's why I'm now.
That's marvellous. Thanks very much. And last but not least, Amy.
Hi, so my name's Amy. I am a clinical practice facilitator now, but I'm a qualified midwife, qualified in 2016 and have worked my way all over the place in maternity. So many different job opportunities in learning, teaching, specialties. I've been ward managers, deputy ward managers, and now in education to support students in different ways people can become a midwife.
That's great. Thanks everybody for those introductions. I think Rob's doing a sterling job of replying to some of the questions in the chat there, so please do feel free to continue asking those. There's a few questions that I'll just ask now that have cropped up or in themes. One of the ones is around what wanting to work for the NHS in a clinical job, but not necessarily wanting to work on a ward. Would anyone like to answer that about the kinds of jobs you might be able to have in the NHS that are not on a ward? I'm thinking maybe any of the AHP colleagues on the panel, or perhaps Emma.
Yeah, I'm happy to. There's so many jobs, I don't really know where to start. On the AHPs, there's 14 professions, from different therapies to physio, occupational therapy, dietetics, audiology. I mean, there's a massive, massive list, and these careers they're all very unique professions, and they require specific things. For example, in radiology, I love the application of science, but I love looking after patients. We go to a ward to take an x-ray and come back again, so our patients come in and they go. Whereas the therapy is OT and PT, there's that continuation of care. The patients are coming backwards and forwards to see you, and you get to sort of see the results on the patient. And speech and language therapy, again, going out, and the work I've seen with them enabling people to speak after a stroke is just incredible. There's so many different professions. There's also the non-clinical side of things, our HR and finance areas, and the outpatient clinic areas. We've got staff that work in fracture clinics that are plaster technicians. There's so many different things, but it's really sort of thinking, well, actually, what do I like to do? What would I like to do? And how do I want to apply this? Because you spend the majority of your time at work, don't you? So you need to enjoy it. So it's really worthwhile. And if you're not sure, get in touch with your local hospital and see actually what you can do in terms of scoping out sort of where is going to be best for you, and try a few different areas before you commit to any sort of training. I hope that helps.
Thanks, Emma. That's great. Another one is around nursing and the different nursing roles within nursing. So perhaps if I can hand over to Andy and Roger for this one, just to talk a little about different types of nurse that you can be.
So I work with lots of different types of nurses. There are adult nurses, pediatric nurses, mental health nurses, learning disability nurses, nurses that work in safeguarding, nurses that work in ED, lots and lots and lots of different types of nurses that work within a hospital.
Lovely. Anything to add to that, Andy?
Yes, I think it's probably, Emma touched on this previously. I think it's about deciding what it is that you probably feel like you may like to do, and then look at what type of pathway you need to take for that. And do some research around it, and indeed do talk to people within an organisation in that particular role that you'd like to take, because there are so many roles. But it's equally, it is down to you. You know, whatever it is that you think you might like to do. But I'll let you into a little secret. What we think we might like to do and what we actually end up doing is generally two different things within nursing.
Thanks, Andy. Just picking up on a couple of questions from the chat. There's lots of questions coming in about psychology and psychological professions. So it might be handy to give a bit of, if it's possible, an overview of the different branches of kind of mental health and psychological professions that are out there. So maybe Brendy, Sonali, a bit of Roger as well. You could all chip in for that one.
Yeah, I mean, Sonali will talk about the pathways to becoming a clinical or counselling psychologist, both of whom work for the NHS and elsewhere. Just to say that because it is quite challenging to get onto the doctoral program that you need in order to become a clinical or counselling psychologist, a lot of people go a circuitous route. So you can become a support worker, you can be an assistant psychologist, you can be a clinical practitioner. And I know Rob spoke about some apprenticeships in relation to those. You can be a well-being practitioner. The other thing is, you know, everybody puts clinical and counseling psychology on a bit of a pedestal, but actually you can get as much fulfillment and engagement in a lot of related professions, including family therapy, psychotherapy. We have specialist nurses on our team, who, especially high-risk nurses who deal with patients with high-risk issues. We have support workers, we have social workers. I don't know if I've left anyone out, but there are loads of routes to get to the same place, and some are as fulfilling as others. So, you know, having to do the doctorate is not the be-all and end-all. There are other routes to working with patients, both children, adolescents, and adults, via other pathways. You can do counselling degrees. I'm not sure if any are apprenticeship related. Sonali, maybe you can say more.
Yeah, like Brandy said, a lot of the roles that you can take up, it depends also on the type of therapy that you might be interested in. You can specialize in one particular type of therapy if that's what you prefer. And in terms of the training, like I think Rob has shown us today, there's a lot of different apprenticeships available, but also you don't have to do a doctorate if you want to do a role in say CAMS or in an adult service. I've never worked on a ward, so that's another thing. You don't have to work in a ward if you don't want to. There's a lot of outpatient and community services that you can work in. Yeah, I think that kind of answers the question, hopefully.
That's great, thank you. That's lovely. I think Amy, you've answered the midwifery question really nicely in the chat. So if anyone's got a question about midwifery, there, that's in there. Donald, what is it that made you want to be a pharmacist?
So basically, when I'm doing a level, I like a lot of the medical field, and especially I love the medication as well. As a pharmacist, instead of dealing with patients, I deal with a lot of like medications wise. So like how to optimize patients' medications, and this is what I was passionate about during A level, and when I was like working as a pharmacy technician. So like something like when I was working as a community pharmacy dispenser, I see just how a pharmacist in the community can support the patients. How do they support the medications? This is something that doctors doesn't really do because they're so short, but for us, we're in the front line of the community pharmacy. So this is something that I like helping the patient as well, and customer patients as well.
Thanks, Donald. That's great. Lovely comments from Roger just put in the chat there. Another question that I get asked quite often is that I want to work with children. What kind of jobs could I do within the NHS? So I don't know who wants to kick that one off. I think most roles have got an adult or a paediatric component to them. Connor, do you want to come in on that in your role?
Personally, I don't work with children, but I have done, one of my placements was working with children at Pace School, which is a school for children with neurological deficits as well as cerebral palsy. And you can work with a wide range of children. Personally, I've not worked in any inpatient settings, but as an occupational therapist, but I know as a physiotherapist, there's huge scope for paediatric physiotherapy. And when I was working at Pace, which is, like I said, a school, and they had an outpatient service, there was physiotherapists, occupational therapists, as well as speech and language therapists working there. The scope for paediatrics is almost as big as the scope for adult working. So there's plenty of opportunities for working with children if that's something you want to specialise in. But of course, when you study, you'll have to do both. It'll be incorporated both adult and children, but when you are qualified, yeah, by all means you can dive into the huge scope that is paediatric work.
Thanks, Connor. Just coming on to work experience, because that's a theme picked up on a lot of the questions in the chat, is around what kind of work experience would the panel recommend getting, and the best way of going about that. Roger, do you want to come in on learning disability nursing and any thoughts on sort of getting work experience, or where to try and get work experience?
Absolutely. So I started off working as a carer. I started off working in Essex as a carer, and then I became a senior carer. Moved then on into working in lots of different settings within care work, which was fantastic. I thought that's what I was going to do forever, you know. And then an opportunity came up where I could become a learning disability specialist nurse. So I went and did my degree in that. And then I started off working in palliative care in Oxford for people with learning disabilities and autism. Quickly moving on then into the community, working in the community, working in secure units. So, you know, one of the things that Rob said earlier was to make the most of any experience. And volunteering is definitely one of them. It's a fantastic way of getting some extra experience. So, you know, in the summer holidays, maybe a day a week, 2 days a week, it'd be really great, you know, go and volunteer. It's really, really worthwhile.
And then similar questions, I think Brendy and Sonali, a lot of interest in psychological professions, and any tips or advice on getting work experience, the wheres and the hows for that?
Yeah, I think people get stuck on having to work with a clinical psychologist or counselling psychologist, and actually there's so many other pathways to getting experience. I mentored somebody who then went on to do psychology, and we got her some work for a community organisation where she had to interview elderly people, had to have chats with them, had to write a piece of work after having interviewed the various volunteers who supported members of the community. There's a multitude of online courses that you can do in mental health and well-being. A lot of them are free these days. And I would say speak to people, interview people, write up interviews. I had a few other suggestions. If there's any capacity to mentor at school, that's quite a good avenue, or to do a mentoring program. There's also mental health CPR run by some charities. I'm not sure which ones, but I think Mind and the like might have something like that, which is basically ABCs of mental health and well-being. If any of you have an opportunity to do some kind of research project like an EPQ at school, those can be really interesting and also give you a lot to think and talk about, and also help you make decisions about your future, especially if you focus on what you're interested in. There are loads of books and a huge number of podcasts. I'm particularly interested in listening at the moment to the ones on Jungian therapy and dream interpretation, which I think appeals to a lot of teenagers. There's also a lot about diversity and inclusion and how psychology are making strides in relation to accommodating diversity in the profession. And there's some fantastic podcasts on that. There's loads of stuff on CBT and you know, self-help. There's some interesting books, including what, if you're particularly interested in neuropsychology, and things like The Man Who Mistook His Wife for a Hat, and other really interesting books like that. In fact, that's what brought me to psychology in the first instance, was a book I read on psychoanalytic psychotherapy that I just loved so much that I went into the profession.
Yeah, I also wanted to add to that. I did a lot of experience outside the NHS too. So like working with victim support, a lot of my friends have helped with like Shout, the helpline. So just, there's so many different charity organisations that you can get involved with, but a lot of it is voluntary. But the more things you can get stuck into, the better. You'll get so much more experience from working with different people as well.
Thank you. That's really, really good answers. Another question that's quite relevant, I think, to where everybody might be at is, what is the interview and application process like? So that's obviously going to be different for everybody on the panel. Emma, I might hand over to you. You described you had quite a varied career path through the NHS, so you might be a good person to kick that one off for us.
Yeah, I certainly have. Certainly, I mean, even at entry level, it was quite daunting coming into the NHS, the application process and everything. And it doesn't happen quickly, but we are doing work on that to try and speed it up. But initially, it's getting on NHS jobs or through another channel. There's so many ways to find NHS jobs. And then it's just a case of filling out application forms. The application form filling in is essential. It's really important in there that there aren't spelling mistakes, that you really do spend time on your personal statement, highlighting what qualities you have to support that role. And then it's a case of I would, if you can, go and get some experience in that role. So contact the email address linked with the application process, get in touch with them and say, can I come and see the department? Can I come and have a look around? And I was even questioning my first CSW job, the support worker role. Well, why are you doing this job when you've got, 4 A levels? And I said, actually, why? I don't know. I want to go and do a degree in a career that I know nothing about. So this is my opportunity to get into the NHS at the Queen Elizabeth, find out about radiology. And then I went on stepping stones and went through university interviews, which is another it's another thing to think about if you want to progress in your career. But once you're in the NHS, the support through application processes, even interview training and prep and planning for jobs and getting your applications checked internally, there is so much support there, like Andy said, but it does vary across all levels. And then as you progress, jobs tend to be advertised internally, so you'll get another different application process. And the interviews vary depending on what banding or what level you're coming in at as well. So there may be 2 on the panel, there may be 5. My most recent job, there were 5, and it was 2 hours long, including a presentation, and it was terrifying, but I actually came out of it and felt I felt really good about it actually. And then an hour later got a phone call and I'd got the job. So it's all about preparation, really making sure that you're specific in your person specification. We spend a long time going through hundreds of applications, and it's those that stand out that really meet the qualities for that specific job. So really look at the person specification, the job description, the hours, really know the job inside out. But do come and visit. I know we're now sort of enabling people back into across the AHP services to come and do work experience, or just come in and do a visit. And like Andy said, just telling somebody that you're interested is the start point. I hope that helps.
Did anybody else want to add anything about application and interview process for your particular roles?
So just to sort of reiterate what Emma said, you really do need to be sure 100% in your own mind that this is actually something that you would like to do, and then reach out to the appointing manager for an informal discussion around it. You will then stick in that person's mind, say, oh, such and such, really interested in that position. But if you're struggling at all with the application process, I know indeed with our trust at the Queen Elizabeth Hospital in King's Lynn, we do offer support around that, and there has been workshops locally in town around that application process, because it can be very, very daunting when you first try. But as Emma said, you must read and proofread it, and then have somebody else read it as well to make sure that there aren't any spelling mistakes and grammatical error. And please don't just copy and paste from one section to another or one job advert to another, because as a shortlister, as Emma had said, we see this on a regular basis, and we're actually looking for you. It's the person that you are, and see whether you actually fit for that position. But just ask if you need some support.
Thanks, Andy. How are we doing for time, Claire? I'm aware it's 1:15.
Yeah, probably coming to the end if we can, Nicole. Yeah, it'd be good to round it off. We've had a huge amount of information here. It's been brilliant.
Yeah, I think thanks everybody for your questions. I think if I'm right, any questions that we haven't answered, we can find the answers to and get them to you. Is that right, Claire?
That's correct, yes. So any of the questions that have come through on the chat, we will have recorded anyway. If Rob and the panel haven't answered them, absolutely, we can get those to you, get the answers, and then email those out along with the recording of the session as well. Yeah.
Great, right. I think we can bring it to a close then. So thank you everybody on the panel and in the audience for asking questions. It's been great. Really nice to have such a variety of questions and great answers from everybody as well. Thank you.
That's great, thank you. I'm just going to share my screen here, hopefully, so it brings up a feedback QR code. It would be absolutely fantastic if we can get anyone who's joined today the feedback, just to make sure that we are, sort of presenting young people with the relevant information, that it's been useful and as we wanted, and obviously to give us tips. Andy mentioned about all feedback being good. and absolutely we will use it to make sure we get the relevant information out to you. So I'll just leave that up as we just say a final thank you to Nicole and Rob and the panel. It's been insightful, it's been full of amazing pointers, experiences, and hopefully given our young people in the audience food for thought. And yep, to raise their awareness, raise their aspirations, and I guess to share the huge amount of opportunities that are there that potentially until today no one knew about. So thank you so much indeed. Very, very pleased with the input from everyone, and it's been great having this opportunity to share experiences with our young people. So thank you very much indeed to all of our NHS colleagues.
Thank you. Thanks for having us.
Thanks. Bye-bye, everyone.